Hi, my name is John Mita and I'm going to talk about the catheter ablation for ventricular arrhythmias. In the definition, we have the catheter ablation is an intervention that uses energy to treat the site where the arrhythmia originates. It is a type of energy that uses radio frequency waves to produce heat and destroy the area of cardiac tissue that causes the arrhythmia.
Ventricular arrhythmias. Extra heartbeats originating in the lower chambers of the heart are called ventricular arrhythmias. These range from single extra beats called extrasystoles to prolonged or sustained episodes, as occurs in ventricular tachycardia or fibrillation. Ventricular tachycardia is a condition in which the larger chambers of the heart beat fast, but the rate in the upper chambers remain normal. It occurs usually as a complication of heart disease and can be dangerous if untreated, leading to blackouts. Ventricular fibrillation results from very fast, erratic, and uncontrolled electrical signals in the ventricles. This is potentially a very dangerous rhythm, as it causes the heart to quiver rather than beat, invariably leading to blackouts within seconds. The treatment of ventricular arrhythmias depends on the type of rhythm disturbance detected on the ECG or heart monitors. Sometimes no treatment is required other than lifestyle changes and avoiding triggers such as caffeine, alcohol, stress.
The application in medicine, the catheter ablation has emerged as an important and effective treatment option for many recurrent ventricular arrhythmias. It is a procedure where areas of the heart are electrically inactivated or ablated to resolve an abnormal heart rhythm.
For certain types of arrhythmias, a catheter ablation procedure may be necessary to stop the heart tissue from causing the arrhythmia. After numbing a small area in the groin with a needle, the doctor will insert a short hollow tube called a catheter sheath into the femoral vein. Next, a long, flexible tube, called a catheter, will be inserted through the sheath. The doctor will guide the catheter to the heart through a blood vessel that goes to the heart, called the inferior vena cava. The location and progress of the catheter will be monitored. When the catheter reaches the heart, the doctor will guide it to the area that is causing the arrhythmia. The doctor will find the problem areas using a 3D map of the electrical activity of the patient's heart. The tip of the catheter will emit either hot energy or cold energy to ablate the tissue in this area. Ablation makes the treated area stop working.
The pros and the cons. The pros: high rate success. On average, ablation has a 70 to 80% success rate. Advances in catheter technology, imaging and mapping techniques has improved success rate for ablation. They have quick recovery, and it provides improvement in the quality of life. Low risk of complication, fewer than 5% of the patients develop any problem. In the cons, we have the ablation close to a coronary artery possesses a risk of acute coronary occlusion and should be avoided. Patients with severe left ventricular dysfunction can have major hemodynamic consequences following prolonged procedures like this. The issue applied in Ecuador: there are only a few health facilities in Ecuador that offer this procedure. However, it has been possible to notice improvement in patients. In Guayaquil, the cost of the cardiac ablation goes around $30,000. And in conclusion, catheter ablation has emerged as a major tool for the non-pharmacological management of the vast majority of the arrhythmias. The careful planning in knowledge of the various techniques, approaches, and management of complication are the key components of success VT ablation. Thank you.